A very warm welcome to everybody zooming into our session today. I'm Virginia Birrell, the CEO of the Australia-China Business Council in Victoria. I hope you were able to see the earlier speakers this morning. They covered a terrific range of topics and were very informative. I acknowledge the traditional custodians of the various lands on which we work today and the Aboriginal and Torres Strait Islander people participating in our sessions. I pay my respect to their elders past, present and emerging, and recognise and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of Australia. We're delighted to have you all participating in our session on global health tech innovation in an era of turbulence. I'm very pleased to be joined today by Dr. Zachary Tan, Chief Strategy Officer of Cancer Aid and Research Fellow at the Centre for Eye Research Australia. Ms. Carol Allen, Aged Care Consultant, Board Member of the Bays Healthcare Group and former Director of Sapphire Holdings Group. Mr. Michael Woods, the CEO of NextMed Capital, and my good friend and colleague Jason Sun, the CEO of the Australia-China Health Accelerator and Chair of the ACBC Health and Medical Research Working Group. And Jason will also chair the question and answer session after the presentations. We could pause for just 1 minute and if our speakers could all give a nice smile to the camera. I think our support crew will take a nice screenshot for a record of today. So that'd be terrific. So on 3, 1, 2, 3. Thank you. Terrific. Now that's all the housekeeping done. So thank you to everyone for your tolerance with that one. It's now my pleasure to ask Dr. Zach Tan to come to the microphone. Zach was recently a winner of the 40 Under 40 Most Influential Asian Australian Awards. So warmest congratulations, Zach, on that achievement. I did mention his working role is as the Chief Strategy Officer at Cancer Aid and Research Fellow at the Centre for Eye Research Australia. Zach will speak to us on the Australia-China opportunities for healthcare in the current landscape. So over to you, Zach. Thank you.
Thank you very much, Virginia, for that really kind introduction. Let me just turn on my share my screen, and Leo, you may need to give me access for that. But today, I'm delighted to speak to you about the Australian-China Healthcare Partnership and Investment Relationship. Certainly an overview of the last 5 years of growth, as well as a prognosis of what's ahead. As Virginia mentioned in her very kind introduction, I'm currently the Chief Strategy Officer of a digital health company in Australia, which is exporting its services into the Asia Pacific region, as well as a Research Fellow at the Centre for Eye Research Australia at the University of Melbourne. Last year, I was very fortunate to spend some time at the Schwarzman Scholars Program, Schwarzman College at Tsinghua University, and lived in Beijing for some time. So today's presentation is a culmination of my academic research, as well as my lived experience working in industry. So if I may just be able to share my screen, Lee, I think you might have to give me permission for that, or the tech support. Well, I'm just, that screen sharing access I might require.
Do you need me to share from my end, Zach?
If that's easier, Lee, that may suit. Although I will rush through the slides, I just don't have that host permission just yet.
Oh, okay. Let me make you co-host. Sorry about that.
No worries. There we go. Thanks very much. All right, is that coming through? Perfect. Thank you so much. Well, like I briefly mentioned earlier, and as many of you in the audience may know, Chinese ODI in Australian healthcare has really rapidly grown. From nil notable investments before 2015 to today, investment has reached 9.2 billion Australian dollars over that time. And in fact, Australia is the largest national recipient of all Chinese ODI globally in healthcare services and hospitals. So that is to say that out of any country in the world, Australia has been the largest single country recipient of Chinese ODI healthcare. Now, despite this tremendous growth, there has been very little formal understanding of why that growth has occurred. I believe, and certainly I should mention as well that I have a background as a medical doctor before moving into healthcare technology. That my thesis, my vision is that Australian healthcare can develop and grow into a leading knowledge-based export for our economy, similar to other industries like tertiary education. And the context to why this research has occurred is to really dive deep and understanding the strategic detail, the strategic sort of nous for why a lot of these investments had occurred. So the primary research questions have been, why has there been a significant increase in Chinese investment into Australian healthcare? Which Chinese domestic healthcare needs does it satisfy? And lastly, looking into the crystal ball and putting some predictions or prognosis to how these investment trends may change in the decade ahead. So between 2015 to 2019, 17 major transactions over $100 million Australian were identified. This is an overall summary table. I'm conscious it's a very busy slide, but it's an overview of the Chinese investor, the type of investor, whether they are private or sort of state-owned enterprise, the company, as well as the healthcare subsector which received that investment. What you will see, the key takeaways from this slide is that investment has been primarily privately held or come from private sources in China, as opposed to state-owned enterprises, and that there's been a great diversity in the different types of subsectors which have received investment. Now, why has this investment occurred? When we looked at the literature and carried out the expert interviews, a lot of this investment has been driven by local domestic Chinese needs. Certainly in the period between 2015 to 2017, as we know, there was tremendous growth in Chinese ODI globally in all sectors, although a lot of that growth, which was arguably rational or perhaps somewhat irrational at points, has now been curtailed. Secondly, there's been enormous growing domestic healthcare need in China, supported by policy reform and privatization, as well as a domestic Chinese agenda for value chain upgrading and innovation. A lot of these policies are characterized, for example, in the Made in China 2025 agenda, which identified biopharmaceuticals and medical devices as 2 of 10 key high technology industries which China seeks to develop. In terms of healthcare policy and privatization as well, there was a major policy paper which was put out around 2015, focusing on the Healthy China agenda, which called for an increased role of private hospital participation and industry to improve equality and access to healthcare within China domestically. So really, a lot of these investments have occurred in the context of a significant domestic focus on healthcare. In terms of Australian healthcare, and this is again, we looked at the period initially between 2015 to 2020, or 2019 rather, Australia is generally recognised globally as having achieved a very successful blended healthcare system that provides both very high quality care as well as cost-effective care. For instance, the Commonwealth Fund, which is a leading global healthcare think tank, ranked Australia's system in 2018 as the second best performing globally in terms of outcomes and first in terms of cost effectiveness. This, our blended system also allows for private healthcare stakeholders to grow. For example, large healthcare providers, private healthcare providers like Ramsay Care or Helios Group. And these companies have a demonstrated track record of financial success and long-term growth. So, Australia sort of up to at least the pandemic period had secular growth factors, including population growth and immigration, which made it a very attractive market compared to other advanced economies. And certainly a lot of these investments were supported by Chapter, which was signed in 2015 as well. So in terms of the strategy, so this research was carried out by interviewing 14 or so key stakeholders and subject matter experts in this area, including investors, as well as companies which have received investment. All experts noted in their in their responses in their interviews that investments were invariably made with an underlying strategy and incentive to export back to China. And in fact, investors believed they could add significant value to their investment by facilitating that market entry, providing those investors a competitive advantage and enabling them to perhaps bid at a valuation premium compared to some of their competitors. Although in terms of that export orientation, one should note that there's significant differences, very different challenges in the export of healthcare between goods, for instance, medical devices, pharmaceutical products or supplements, versus services, which may be much more challenging to export. In terms of subsectors, we looked at a variety of different subsectors, and I'll highlight a number of key subsectors which came up in this research. Certainly, healthcare services in hospitals has been one of the most popular subsectors over that 5-year period. Key transactions are noted in the right-hand side of your screen. So they include prominent Australian healthcare groups, including Genesis Care, Icon Cancer Centre, Vision Eye Institute, as well as Helios Group. And a number of the investors who made those acquisitions are also listed here. In terms of these private service providers, fundamentally, they have been viewed as attractive assets, particularly in a fee-for-service model in areas like radiology, ophthalmology, IVF even, where stable payment structures and with the medical benefit scheme, as well as with the Medicare benefit scheme, as well as strong secular growth, has led to those investments really being viewed through the lens of sort of a growth equity or private equity type investment. And the strategy behind a lot of these investments has been to fill that clear domestic policy need, which has been to call for increased privatization as well as market competition in the Chinese provider space. Now, where the nuance is, and where there has been a lot of variability between these different investments, is the means in which healthcare services are exported to China. In its purest or in its most simple form, there's a medical tourism model where these companies facilitate Chinese patients to come to Australia to receive healthcare. The complete opposite is for these companies to directly own hospitals within China, so own and operate hospitals within China, with provisions within CHAFTA enabling that export model. And I think what we're seeing a lot of now is a management services model, where Australian healthcare providers provide their services and provide their consultancy expertise to Chinese healthcare vendors. There are some limitations and challenges to this trend. Certainly, there needs to be consideration of domestic Chinese patient utilization patterns. In China, healthcare remains very hospital-centric in its care delivery, with a real gravitation towards large tertiary public hospitals, and building that brand recognition and, most importantly, that trust, such that healthcare consumers in China are willing to come to a private facility remains very difficult. And I think the jury is still out in terms of how a lot of these investments will perform. The second most popular subsector, which I'll describe, is supplements and wellness products. Certainly these have been supported by Australia's brand as a very clean, green and healthy market. And indeed in 2017, 3 of the top 10 health supplement brands in China were Australian. These goods are relatively easy to export, and provisions within CHAFTA have made them even easier, particularly with the elimination of tariffs. And prior to COVID, of course, I have to distinguish and caveat a lot of this research was done prior to the pandemic. There was a large market in terms of Daigou services exporting these products to China. The third sector, which is very interesting, is the life sciences sector. Life sciences describes the development of new medications or biopharmaceutical products. And certainly this has attracted a lot of attention in recent years. In my view, and certainly through our expert interviews, the sectors in Australia and China are very complementary. Australia has extraordinary medical research prowess, but what we are often challenged by is the difficulty and some inertia in commercializing and translating a lot of this really fantastic research in terms of into products which can be used by patients. Within China as well, there has been an increasing focus on drug innovation and a shift from generic manufacturing, which is really what Chinese biopharmaceuticals has been known for previously. We have seen in China the rise recently of new capital markets, including the STAR index, as well as the HKEX index in Hong Kong, which support a lot of emerging biopharmaceutical companies in China. And I think what we are also seeing potentially as an emerging trend is that innovative Chinese life sciences companies are looking to move abroad. And Australia is very well positioned as a clinical trial site for these companies hoping to come to Western markets and to export their goods outside of China. Very similarly, similar trends also underpin medical devices. Australia has a very proud record of medical device excellence through companies like Cochlear and ResMed. A lot of the investments that we've seen into Australian medical device companies have quite diverse investment structures, including licensing, manufacturing, and distribution rights. And similar to life sciences, Australia is very well positioned as a pilot site for Chinese medical device vendors looking to go internationally. I would just highlight two more sort of subsectors very quickly. Research and technology. Australia has traditionally been very strong in medical research, but relatively weak in the development and the commercialization of these products. Australia I think, has positioned itself really as a fantastic place for validation and for clinical trials. The R&D tax incentive certainly helps offset a lot of the costs of clinical trials. And the sort of generally accepted wisdom is that to run a clinical trial in Australia for a similar number of patients is perhaps roughly 50% cheaper than it may be in the United States. Australia as well has a very well-regarded medical system. So a lot of the data generated from clinical trials based here in Australia is mutually accepted in a number of other Western markets. Digital health is certainly a subsector which I'm most familiar with my role at Cancer Aid. And I think export Australian technical expertise in terms of digital health is very interesting to China, but I think vice versa. I would say that the Chinese domestic digital health market is perhaps the most exciting in the whole world right now, with a lot of virtual care models or internet hospitals, as they say, attracting a lot of attention and really being accelerated in their growth due to the COVID pandemic. I think where China has a lot of strength in digital health is in its development of AI technologies, including ophthalmology, radiology, which are dependent on large volumes of data and moving quickly. And we've seen some extraordinarily promising Chinese AI companies come out of China, and certainly Australia as well being a landing pad for those technologies coming abroad. I will sort of race through the end of the slide. I'm conscious of time, but I think really if I had to distill down, why has Australia been relatively successful in its healthcare investments? I think, we have a history of healthcare partnership between China and Australia. I think, the ratification of CHAFTA compared to, FIRMA, which really imposed a lot of limitations on Chinese investment in the United States market in 2018, has certainly assisted. I think a large Chinese diaspora in Australia has also assisted that cultural link, and that sort of cultural link has that bridge in fact has supported a lot of these transactions. In terms of limitations, it goes without saying that there's extraordinary risk, transaction risk currently, and a cooling of relationship bilaterally between the two countries, with increased regulatory scrutiny and further scrutiny in Australia. But I think it is also fair to say that there was a natural slowing of transactions before the pandemic as well. And what we started to see in 2019 was that a lot of these transactions were already starting to slow for a number of reasons. In terms of prognosis, I'll finish on prognosis very quickly. I think the outlook is likely going to be limited in the short to medium term, and there'll be no major transactions completed between 2019 to today. The impact of COVID continues to make itself felt whether that be through FIRB scrutiny, travel restrictions, sort of examination of export strategies to China. But I think fundamentally, across all these interviews, private investors continue to seek commercial return. And I think there remains a long-term sentiment that Australian healthcare is a very strong asset class. And I think there are complementary advantages between China and Australia. So that is very encouraging. The likely subsectors that outperform post-COVID as we approach this new normal, hopefully soon, in my view, are likely to be the life sciences, medical devices, and digital health subsectors. I think with the appropriate protections and a nuanced approach, I think there remains extraordinary long-term opportunity to export Australian expertise and develop our domestic healthcare market as a significant knowledge-based industry. And there are a number of initiatives, including Jason's role at the Australia-China Health Accelerator, which will be very powerful in rebuilding some of those relationships and bridges. So I will leave you there. I apologise for rushing through the slides a little bit, but again, it's been an absolute pleasure to be able to share some of these findings with you today. And if you do have any more questions, please feel free to reach out.
Thank you very much, Zach. And I guess a question to all our presenters, are you happy for your slides to be shared with our guests? Because that information was wonderful. So if you're all happy, we will do that, or Li Zhang will be able to facilitate that. Zach, that was terrific. And I'm really glad you mentioned the work of Jason and the Health Accelerator, because I was picking up on your comments in relation to medical companies wanting to expand into the Western market using Australia as a platform. And obviously there is a project Jason's engaged with now on that very topic. So I'd encourage our guests to get in touch with Jason at the Health Accelerator, or yourself, to find out more about that information. Now, if I'd like to move on now to Carol, and we would just like to discuss now the role of service providers in realising innovation in the future of aged healthcare. Carol Allen has enormous expertise in that area. She is an aged care consultant, a board member of the Bays Healthcare Group, and former director of Sapphire Holdings, which has multiple facilities around Australia. So welcome, Carol, and over to you. Thank you.
Thank you. So welcome everybody, and it's great to be here. I'm going to try and share my screen. I haven't done this before, so Lee, you may have to help me.
Yeah, sure. I can share from my end.
But I'll just try here. Is that coming on? No. Is that there? Yeah. Okay, great.
Carol, can you see it now, your slides?
Yes.
Okay.
Okay, thank you. I just want to get to the I'm just trying to put it onto picture.
Okay, you can't do anything. If you want to enter the next slide, you have to let me know. So
oh, this is yours. Okay.
This is from my laptop. So
Okay.
No, if you want to change to next slide.
Okay. All right. So next slide.
Okay.
What I'm going to talk about today is an overview of the Royal Commission, which has been undertaken for the last nearly 18 months and is finishing in February. The final decisions haven't been made yet, but there's a lot of Can you hear me?
Yes, Carol, we can hear.
You can hear? Oh, great. Okay, sorry, just said you couldn't. So what I'm showing you here, and I understand it's a very small slide, Ansell Strategic, which is a large aged care organisation, has proposed to the to the Royal Commission a 10-year strategy on how to move forward, and it's focusing on the first of all the regulation and looking at how and who operates aged care. It's then moving on to funding and staffing structures. I'm not going to go through this, but for those people who want the slide afterwards, it's an interesting slide to look at. So can we go to the next slide? Okay, so moving into the future, the thing that is going to impact aged care is the focus on the demand, and it's going to be a demand-driven system. So with a focus on the consumer, on looking at lifestyle, that's a very key focus now in looking at what it is that the actual consumer wants, not just the care model. And also looking at the surround of aged care and how we can provide that environment that is conducive to people enjoying life. I'm sorry, I can't slide. Okay, that's it. The first thing is the implementation of the industry accreditation and certificate requirement. And that has been a major focus on who actually oversees aged care. At the moment, the federal government does, but there's a strong push to have an independent body managing aged care and managing the funding and how it's distributed. There's also a lot of work going on in specialised in architectural standards and moving from very large facilities with people living in very large communities to what they're calling single household models, where people are living in groups of 10 or 15 people. And that also is very conducive to people who are living with dementia. One of the things that to make aged care in Australia effective and efficient is to have sophisticated systems to enable the delivery of residential care needs and also dementia and palliative care. Next slide. So if we look at the restructuring of the government bodies and the Commission, the Royal Commission has indicated that currently the funding is around $20 billion in 2020, and it's expected by 2050 to reach $170 billion. Now, 3 years or 5 years ago, when the funding model was brought in, which is called ACFI, it was estimated by the government that they would reduce their funding by 50% by 2020. This hasn't happened, and it certainly has, there are strong indications that the government is going to have to significantly increase the funding in this, particularly in this post-COVID environment, where it's just shown up some of the deficiencies in aged care and the need for the staffing structure. So although it's proposed by a lot of people that if we move to an independent body, we don't believe that the government will actually take that large step, but rather that they will review the Quality and Standards Commission. They'll make changes to the Medicare benefit scheme, which is the funding model, and increase funding. I've put a question mark next to that increased funding because over the last 20 years, although there have been many commissions and reviews of aged care and many recommendations that funding is significantly increased, this hasn't happened. So it's highly likely that the Aged Care Quality and Standards Commission will be rebadged, but it actually will still be controlled by the government. The other restructuring that will be going on and has continued over the last 12 months is the clearing of the home care packages waiting list. And while this is urgent and the government has promised it will be reduced by 2020, it's highly unlikely that it will be removed by then. Can we go to the next slide? So the accreditation standard was reviewed 12 months ago, and it moved from 4 standards to 8 standards. Those 8 standards now have got a very strong focus on consumer-directed care and what it is the consumer wants, and a lot more involvement during actual accreditation visits where the consumer is spoken to and the agency is finding out a lot more about how they are feeling, about how they're being cared for. And the other major change to the standards was a very clear focus on governance and making the boards and the operators much more accountable for the services that were being delivered. Can we go to the next slide? So if we look at aged care funding, it's divided into a number of areas. There's the basic fee that the government pays now, and which is means tested. That fee is where a lot of the discussion about funding is. At the moment, the fees for the individual residents, the government funds around 75% of that basic fee, and the actual consumer or resident funds the 25%. And that's a moving feast depending on what people's income are and whether or not they are on pensions or they have independent means. So when we talk about government funding, it's mainly focused on that fee model. There is then what we call the accommodation RAG. That is, in simple language, it's a bond that the resident or the resident's family pay, which is based on a refundable deposit that they pay when they enter, and it is returned to them once the resident leaves the facility, either by moving or being deceased, and it's returned without any interest, but the basic amount is given back to the family. That money is used by most operators to build and to grow their business. Those funds can be used to buy or develop new facilities. It can't be used for operational costs, and it has in the past, and which we can hope it will continue to do, is guaranteed by the government. So if a company or business goes under, the government guarantees that all the families will receive their RAD back again. There are also extra service fees and additional service fees which don't really amount to a significant amount of money, but it was a decision that the government made that we could charge those extra fees, but as I say, they're very limited. So that's the funding model. If we just go to the next slide. What the government is now looking at is what which is called a case mix funding, which is very similar to the way that hospitals are funded. It will replace our ACFI, which is the funding model that is used now, and replaced with this ACC, which is a case mix funding. What we believe will happen in the future is that we'll be looking at an integrated approach between case mix funding for residential care and a separate funding for home care. And if you look at the first slide I showed you, it is expected that this new funding model will come into operation around 2022-23. It's being trialled at the moment. There's still a lot of concern about how this funding model will work, and it's based on a 50-50 approach where the operator will get a lump sum of 50% of their funding, which will be consistent, and then 50% of the funding will then be assessed on the actual care needs of individual residents living in the facility. And it's not clear yet whether that 50% will be increased as care needs increase. So there's still a lot of work to do to make sure that this model is actually workable. Next slide. This just gives you an indication of the funding and how it has increased. That slide is a little bit old, but the funding will continue. And as I said, at the moment, it's around the $70 billion, and it's increasing significantly. And the breakup of that is with the fees is that 29% resident contribution, 71% government funding. And as I say, the government's aim was that they would contribute 50% and the residents would contribute the other 50%. This hasn't eventuated, and it's highly unlikely that it will. If we can go to the next slide. Another big discussion point has been around staffing levels. That's the slide. The first part of it shows the current staffing levels. The two in the middle show the government sort of recommendation of what they're looking at, and the last one is what the ANF, which is the union, is suggesting. Again, looking at this staffing model, it's anticipated that if it is implemented, it would take 2 to 3 years, maybe 4 years before we could move to that. If we go to the next slide. I'm going to talk a bit about the model of care, because one of the things that's happened over the last probably 15, 20 years while I've been in aged care is we've moved very much from a medical model to a social model. So the recognition that people living in aged care are not sick and are not, they don't need a very strong medical model. If they do have some kind of care needs, those are catered for. But on the whole, we encourage people to live a life that is full of activities and engagement and enjoyment. So that has a lot of benefits to everybody, because people stay fit, they stay happy, they stay active, and they don't become depressed. If we go to the next slide. So just to give you an idea of what that model looks like, it focuses on person-centered care, and again, the new quality standards are very much focused on that model of person-centered care, which focuses on who the person is. It's looking at capabilities and learning. There's a lot of restorative therapies built into it. It's a holistic care model and focuses both on physical, emotional, social, spiritual care. It's about building relationships with the community, building the relationships with families, creating memories, very strong focus on customer service, meaningful engagements, and again, training of multidisciplinary staff. When we've looked at the Commission, the main focus has been on looking at personal carers and nurses, but there are a raft of people that are working in aged care. There's physiotherapists, there's speech therapists, there's dietitians, there's leisure and lifestyle, there's home cleaning services, there's food services, it's not just one level of care. So if we go to the next slide. Consumer directed care. Sorry, I've got a phone in here. I'll just ignore it. The council assisting the Royal Commission should be applauding for recognising that rigid minimum staff ratios should change. However, as I've said, it's extremely complex and many variables, and that it may result in a move towards a medical model, which the industry has been trying to move away from for the last 5 years, with more the focus on the consumers. And as I said, the consumer is strongly endorsed by the changes to the Quality and Safety Commission. We go to the next slide. Dementia is the fastest growing cause for people to come into aged care at the moment. And this is particularly related to the fact that people are living longer, and now in the current environment, people are coming into aged care in their late 80s, 90-year-olds. There are more and more people living to 100. And with that aging, it becomes more people coming into aged care are suffering from a level of dementia. And the environment is so important for dementia care. It's looking at how do we actually provide that wellness model, and how does this impact on how we care for people with dementia. There are many adaptations happening at the moment. There's the greenhouse model, which is quite relevant in America. And however, the flavor of the moment is this neighborhood model, where people are living in small communities and are not. Sorry, 3 people have raised their hands. Is that a message or something that we need to address? And also, there are a lot of differences in culture and in how we can deal with that cultural needs of the residents. Can we go to the next slide?
Excuse me, Carol, if I could just interrupt. We are closing in on time a little, so I wonder if we could skip quickly through. Thank you.
Can you hear me now?
Yes, Carol, I'm just conscious of time.
No, I'm sorry.
Okay, thanks, Carol. Thank you.
We'll just go through these very quickly. If you just flick through these as I'm talking. This is just our model that we built in Beijing. Next slide. In Beijing, and it was based very much on looking at activities and wellness. Next slide. Next slide. These are just photographs of the place in Beijing, which we did as a joint venture with Coastline. Next slide. Next slide. And thank you. So that's all. Happy to take questions.
Oh, lovely. Thanks, Carol. That was terrific. And I think that the model of care, it is very interesting to see how that can be adapted to a Chinese cultural situation. So I think it's great. And thank you very much for the detail that you went through with that. It's my pleasure now to ask Michael Woods from Next Med Capital to say a few words, and he's going to address the investment. Thank you.
My background, I run a hand sanitizer business which manufactures in China and am building distribution across the Middle East, Asia, Africa and North America. I invest in early stage medtech projects under the NextMed Capital business with some co-investors there. I also advise startups and scale-ups on raising capital through Newburyport, and hold a number of sort of chair and non-executive board positions as well. So, so 2020, I think, is clearly been the year of uncertainty, and you know, I've listed a few here. Obviously, the coronavirus has created enormous uncertainty about how soon a vaccine or what a COVID normal situation is going to look like, and indeed as it relates to cross-border trade and investment, when travel restrictions are going to allow in-person meetings, which I think are an invaluable part of building relationships. It's also sort of catalysed a lot of government and budgetary uncertainty around what monetary policy is going to look like, and how that relates to whether it's budgetary constraints restricting on support and increasing tax policy, or whether it's stimulus and sort of more economic support to drive ongoing growth, particularly in industries that are supporting that growth. And lastly, I've sort of thrown this out there: who's going to be the president of the US? We still don't really know. Obviously, that is going to have an enormous impact on geopolitics. And as much as the expectation is that it will be President Biden that is inaugurated in January, there's still a lot of uncertainty about how that's going to translate into policy, foreign policy and domestic in the US. So I think in an environment of uncertainty, the traditional investment strategy has been to look at many of the sort of what are seen as defensive investments, and I'd just sort of like to say that many of those in the current uncertain environment have become as uncertain as sort of some of the more risky asset classes. And you know, I just highlight property, for example. And I think we're seeing a very significant transition for a lot of commercial property, which traditionally has been a very good investment, and perhaps becoming less safe as businesses evolve in their business model and sort of working from home and other things. Fixed interest, whereas it might be a safer investment class, certainly the returns with globally are very weak from a fixed interest portfolio these days, and with corporate bonds, default risk potentially growing on a lot of those as well, as economic conditions really become more choppy for those organisations. There's certainly industries with macro tailwinds, let's say, but big tech, as good as it is, certainly could be argued to be overvalued, with groups like Twitter and Amazon trading on sort of 90 to the many hundreds of times their earnings, and you know, that suggests that they either have to find new business models to generate more earnings, or it's going to be a very long time before some of those organisations are going to be paying off the PE ratio that you might have invested in them in. So I just sort of thought, in a world of uncertainty, nothing is certain except death and taxes. A very wise man said that. But there is one industry which can reduce your taxes, if not eliminate them, in some cases, and also has the possibility of reducing rates of death, or certainly delaying your own death, and that's really the medtech sector. And I'd like to propose what's otherwise seen as probably a quite novel concept, but that medtech and particularly early stage medtech is a potentially defensive asset class in a very uncertain environment. And I believe it's defensive with a certain sort of investment thesis, and that is that the public will prioritise spending on health over many other aspects of spending. Everybody wants to live longer and healthier. There are many technologies coming out that actually reduce the cost of providing healthcare and improve patient outcomes together. And those are technologies that really should be adopted and have a relatively easy path to market if you're being able to promote to a stakeholder that outcomes are better and it still costs you less. And there's a lot of new, whether it's devices or digital or therapeutics that promise that kind of outcome, and where budgets are stressed, and we've heard that there's definitely a macro trend towards seeing much more adoption of new technology. I think that kind of thesis has value. Obviously, there's a lot of stimulus going out there to promote high-tech industries. There's a lot of new attention being paid to technologies that could have reduced the impact of the pandemic had they been widely used, and so there's a lot of sort of planning around being prepared for future technology. I won't go through in detail, but in terms of tax impacts, obviously there's ESIC tax benefits for early stage projects, which mean you get an upfront write-off of a portion of your investment against your income tax and capital gain tax exemption. So there you go, no more taxes on investments in this kind of product. And also the R&D tax credit, which effectively means that you can potentially spend $1.60 on product development for every dollar that you put in, with the government funding the rest of it. So I think that's an ecosystem that's really quite an interesting one from the death and tax perspective, but it's also shown, at least in the listed space, pretty high returns. So a friend of mine runs this BioShares independent stock reports. He also has a model portfolio, which you can see over a 20-year period has averaged a 20-year cumulative average growth rate in his model portfolio. And I think that's been validated by the fact that more than $1.1 billion of cash has been raised by life science companies in the first 3 quarters of this year, against a relatively uncertain environment. And if you're interested in listed stocks, I'd highly recommend you look into the BioShares index, because it does give very insightful coverage. But the real challenge for a lot of Australian startups is that if you're not listed, there's a real capital starvation, which that's caused by the Australian Stock Exchange actually tightening their listing criteria to sort of try and improve or bring in latter stage, more advanced companies. A lot of the existing traditional VC or early stage institutional investors have grown larger over time and taken more risk-averse positions in latter stage projects. And as this chart shows, the rate of angel investment has rapidly declined, and that's left really a quite defensive buying opportunity, where with the correct strategy, correct risk assessment and diversification and strong execution, there's really quite a lot of value to be created by investing early. Zach really mentioned this in a lot of detail. I don't need to go through it in too much detail, but Australia is a really good test bed for international expansion of and validation of a business model, validation of a value proposition of medical technology. Zach mentioned it costs half as much to run a clinical trial here as the US or Europe, and yet the results are as widely or as well respected. It's also, because of its small nature and relatively collaborative environment, if you get a business model wrong, or if you want to test various business models, it's much easier to work with hospitals and researchers and test out various strategies in this environment than it is in an environment like the US or Europe. We obviously have cultural ties with the Asia Pacific region. We're in a similar time zone. And as Zach mentioned, we have free trade agreements with quite a number of the major markets, including the US and China. So that's quite strong from a company establishment perspective. I mentioned the collaboration and culture and supportive ecosystem. There are so many organisations out there. I probably should have put ACHA and ACTI on here as well, but there is just so many various supporters to reach out to for startups. I don't need to go through all those. These are everything from accelerators to grant writing organisations to networking groups and industry bodies. And we also have a very secure IP environment. I think there's some interesting aspects of this. I won't go through it in detail, but clearly there is a wide range of IP being granted in Australia, particularly from offshore companies in the US and Japan coming to Australia, registering their IP as part of their global strategy, and you can see the rate of Chinese founded applications is just growing really dramatically, and that's also representing both an opportunity for collaboration as well. I'd also highlight that, in fact, in Australia, about 1/3 of all actually granted patents are in medtech relevant sectors, and that's across both local resident applicants as well as non-resident. So that's quite a significant amount. Most of the rest are in metals of mining and technology. And as I sort of flagged, it's really important to have a strategy to de-risk what would otherwise be a quite risky investment class as part of your defensive investment strategy. And I think all of what I've said before really positions Australia as the ideal position to de-risk your risky sort of early stage medtech investment and make it more defensive. So these are, because the idea really is that the further you go down your development pathway, the more expensive it is to fix a problem. So if you can pilot and develop and deploy IP in Australia, or partner with Australians who are doing this and bring some commercial and strategic expertise to them, there's really the opportunity to secure some of the leading key opinion leaders, make sure you've got really good engagement with your users, whether they're clinical or consumer. There's a really high quality consulting and management expertise here, and you can generate clinical data to support international expansion. So I sort of think what that really leads me to is concluding that there's really an ideal environment here for partnerships which are win-win for both investors and startups, and that can really be in a couple of categories. It can be Australian investors investing in offshore IP, particularly potentially from China, with a view to de-risking the offshore expansion and establishing the credentialisation of that software in Australia. And a great example that Zach had on his slide of that is the intelligence business. There's also Asian investors looking to invest in local IP and businesses with a view to trying to accelerate using their own network the offshore expansion of that. And another example of that might be something like Umbrella Health, which is sort of taking a novel approach to a GP clinic business model, which they're looking to establish in Australia, validate in Australia, and then take internationally, including to China. So, I think as a sort of an aside, Zach mentioned just how much ODI there is from China to Australia, and I think that sort of highlights that some of the major organisations and significant sort of really famous companies from China are really seeing that opportunity in investing heavily in Australian businesses, and whereas not everyone is able to buy into a $100 million plus transaction, even in this early stage startups, even $100,000 is a meaningful investment for some of these startups. And so it's about making sure that you're addressing the risk, you're building a properly defensive sort of diversification. And it's really just being, I think if you're going to pursue this kind of thing, aware of some of the key risks, which are obviously relationship based. At the very early stage, it's that transition of researcher to business leader. A lot of local startups do have challenge in understanding their competitive position internationally. There is cultural awareness, risks, and the reality is at an early stage, I don't think there's such a thing as a passive investor. Pretty much everyone you want to invest in and try and assist and help in whatever way you can these early stage companies. So that's sort of the thesis that I have, and that if you get all this right, medtech is a very potentially defensive asset class. And just last month, or now 2 months ago, it turns out that Chris Nave of Brandon Capital agreed, and he goes on to say that biotech sector is a recession-proof sector, and that they're very positive about the future of that. So I think it's interesting that there's sort of, even at the institutional level, there's sort of an awareness of that defensive nature of this sector. So I'd just conclude by noting that not all defensive asset classes are as defensive as people think they are in uncertain times. Death and taxes are both absolute certainties, but medtech can make a big difference in reducing both of those, and that's what actually contributes to its quite defensive nature. Australian medtech sector has excellent opportunities for value creation and excellent opportunities for de-risking. We're an excellent location to go global as a launch pad for international expansion, but there are still risks that need to be well understood and considered, and ultimately it's about having a win-win partnership and finding those whether it's partners as investors or partners as startups that you're confident and comfortable working with. So that's sort of how I review the market and what I think is a relatively defensive investment strategy. So hopefully that was sort of contributed to a rethink or something interesting for you guys to contemplate as you listen to this and consider your own partnerships and investments.
Thank you, Michael. It's lovely to finish on that optimistic note, because we've dragged ourselves through this COVID period, and if there's a light at the end of the tunnel and a few platforms for engagement and sectors where there are opportunities, I think it's terrific to focus on that. So thank you very much for that positive and very informative presentation. There are a few hands being raised. What I might suggest, if anyone has a question, could you please type it in the chat area? I'll hand over to Jason Sun now, the CEO of the Australia-China Health Accelerator, and I'll feed those questions through to you, Jason, if there is time for those to be answered. And we might start off, I'll hand over to you and you can start the panellists on the conversation that we had previously discussed. So without further ado, hand over to you, and I'll just type if there are any relevant questions coming through. Thanks, Jason.
Sure, Virginia. We're running a bit late, so we got a panel discussion, just very short panel discussion during the presentation. So firstly, let me thank my colleague in presenting various topics. I think your presentation is very insightful. So going back to today's topic, healthcare collaboration in turbulent time. Now, given my experience in this area, I mean, obviously we're running a platform to facilitate collaboration between Australia and China in health space, and also 5 years as head of engagement between Australia and Victoria and China, Victorian government in health. Now, I've certainly seen better times. So following the signing of the free trade agreement in 2015, there has been a lot of enthusiasm, what I would call a honeymoon period of collaboration in all sectors, including health. But obviously now we're in a different era. So some of the things were touched on, the geopolitics, the coronavirus, and the gentleman called Trump. So given that current scenario, what we will call a turbulent time, my question is going to Zach first. Now, there is a Chinese word meaning Weiji, meaning both threats and opportunities. So given the current situation, where do you see the collaboration between Australia and China in healthcare? Where are the threats coming from? But more importantly, where are the opportunities coming from? Thank you.
Fantastic. Thank you for that question, Jason. I think, as you say, Weiji it's both a challenge as well as an opportunity. I think in terms of your challenge, well, it goes without saying that your bilateral relationship is currently very difficult. I certainly hope that we are able to see through our differences and recognise that healthcare in many ways is a public good, and that there's mutual benefit, I think, for both countries and the people, the patients in both countries, and in collaborating and working together. I think sort of looking beyond that, really it has been the silver lining, the opportunity of this crisis has been it's highlighted the strength of Australian healthcare, and in some ways it's also highlighted the strength of Chinese healthcare. I think we've seen, Australia as a nation on the whole, respond very well relative to some of our Western peers in Europe as well as in the United States. We've seen some, really wonderful Australian innovation. I went to medical school at UQ, so I'm a little bit biased, but of course, we have one of the leading vaccine candidates right now for COVID. But I think also we're seeing, the tremendous strength of Chinese innovation in biotech and life sciences, which has been the culmination of a, multi-year effort in China. I mentioned earlier that, Chinese biopharmaceuticals, for instance, have traditionally really been known for generics manufacturing and to see the domestic innovation being supported by, by some of the new sort of share market bourses in China as well, including Star Index in Shanghai. I think there's a lot of really promising technology, which over time will be looking to come abroad. And I think the opportunity there is really, like you mentioned, Jason, Chinese innovations coming abroad through Australia. I think initiatives like the Australia-China Health Accelerator are really well placed and positioned to support those companies.
Thank you, Zach. Just following on that theme to Michael. Now, Western media often portray China as the copycat or IP infringer or offender, but the reality is different, right? So the reality is that there's a lot of technology coming out of China. Increasingly, there's a lot of international granted patents coming out of China. So I guess in other words, is China's gone through the copycat phase into a new phase, which many other Western countries gone through, like the US and Japan, gone through the copycat phase as well. So given that reality, what are the opportunities and what are the potential impact in the healthcare innovation, commercialization, investment space do you see? Thank you.
Well, it's a really interesting point that you raise, and we've seen whether it's electronics or automotive, Japan being the copycats, and then the Koreans have been the copycats, and they've obviously to some extent leapfrogged the Americans these days. And you look at where, as a consumer good, foldable cell phones, they're Korean and Chinese. The US hasn't quite managed to figure that one out yet, and so. The copycat phase obviously ends. And I think it's really, I don't know if you remember for the people seeing this, that that one of those slides I showed, the Chinese patents granted, it was nearly 400,000 in 2019. Now, the US was 200,000 in that particular year. So at some point you have to sort of recognize that, and a lot of those are in the healthcare sector, if we're not finding the right model to actually engage with the Chinese innovation, they're going to end up with a better quality and better outcomes and better healthcare than the West is, because they're advancing technology faster. And so I think from an opportunity set, there's both the opportunity to collaborate on taking Western innovation to China, but I think over the next 5 to 10 years, we're really going to see that the opportunity set really evolves much more towards Chinese innovation, and whether it's a push from China outward to commercialize outside of China, or whether it's in fact a pull from Western based individuals or organizations having a growing awareness of the amount of IP that they're potentially missing out on accessing by not having that, and potentially finding more and more organizations scouting for or looking at the Chinese practice and the Chinese innovation as a way to actually sort of bring that innovation to the West. So, and that goes to those two business models that I outlined, I suppose, in the last of my slides.
Thanks, Michael. I think that's a really interesting perspective that you offered, and I'd like to pick up more on that a bit later. But before we do that, and to see if there's any time left, but before we go there, I just wanted to pass on to Carol, ask a question to Carol. Carol, you touched on the Royal Commission, and then there are also some negative media about coronavirus death in aged care facilities across the Western world, but based here in Victoria, we have our fair share as well. So it's fair to say that the West aged care system, or Australian health system, aged care system, has suffered some reputational damage Now in China, everything is branding. So people know that Pinfold, Ben Fu in China know that. So Chinese people are really into branding and prestige. So what are the impact this reputational damage to Australia as, we're trying to brand as a high quality, safety, prestigious offering? Where do we go from here? How do we repair the damage?
That's a very interesting question. I think with COVID, there was so much media and so much focus on aged care. We have to remember that people living in aged care are very frail. They're very vulnerable. Every year we have influenza, or we have other things that attack aged care homes. And actually, last year more people died from influenza, and people this year have died from COVID. But it never hit the media. So, as I say, we had two strains, or two parts of the COVID issue. Was that we had staff who were working across facilities and then transferring that virus into residences. An enormous amount of work has been done around infection control. And as I said, the number of people who did die were mainly in their late 80s and 90s, and were very frail and were very susceptible to the disease. I don't think anybody's experienced anything like that, but certainly we've learned a lot, and there's a lot of focus now on rebuilding that confidence that people have. And I think it's been done locally, and interestingly, people are coming back into aged care now. We're getting more people coming in and doing tours and visiting. So I think that the confidence is returning, and once we have a vaccine, I think that also will contribute to people being much more relaxed about it.
Right. Hopefully our reputation, international reputation on the quality and safety aged care will be repaired, as you say.
Yeah.
So I have a look.
It's probably worth noting on that.
Sorry, Michael.
I was just going to say, it's probably worth noting that it's not just Australia. I mean, the New York had even more aged care challenges than Australia did. The English had massive aged care challenges with coronavirus. The Swedes have had the same. So I'd say, when we sit here and look at our performance, we might be disappointed by what's happened, but it's a performance that's been repeated in almost every Western country, and they're probably all saying our aged care system has had its reputation irreparably damaged. But in a broader scheme of things, I think it's how quickly that can be resolved and understood that will stand, and how flexible they are. And I'd say, some of what Carol's talked about in terms of understanding the challenge and resolving it actually is probably more of a positive outcome from that than other countries might have been able to do.
Great. So I just had a look at the Q&A. There isn't many questions coming through. There was a comment. Zach Egerton has commented the usefulness of the discussion, but there wasn't a question. So I might go back to sort of Michael, pick up a theme he's mentioned. This is about commercialization using Chinese IP in the West. As Michael, you and I had discussions in terms of, it's actually really difficult for a Chinese technology company to commercialize their product overseas. For example, Huawei, as an example, they faced a lot of skepticism and headwinds in the West in the political sense. Zach, you might want to jump on this as well. I'm sure you're aware of those. So in healthcare, now we're dealing with, most of the devices these days have a health data element involved. So it's really hard for them to export their product overseas, product or services overseas in digital health, medical devices, health AI. So what can we do to help them, you know, to potentially set up businesses, places like Australia, and where they can export their product, but benefit, creating also economic benefit for Australia as well, and also, you know, serve the patient's need as well. So, Michael, maybe I'll ask you to come in first, and then I'll go to Zach.
I think it's a fascinating area. I mean, I've worked in Russia, I've worked in Seoul, I've worked in Hong Kong, I've worked in Kazakhstan, I've visited North Korea. I've been in a lot of places, and the fundamental thing is, at an individual level, people are all kind of the same. You know, people all want to do something. They, you know, people all don't trust people that they don't understand. And I give another presentation to sort of other sort of purposes, and it's all about how to build that trust and how to engage with cultural people that you don't understand. And I think for you know, in the West, we often look at China and say, well, how do we possibly commercialize our products over there if we've got some new innovation? Because it's such a complex market, so big, we don't really understand who to go to. And the answer is, well, that's all true. So go and find yourself a local partner in China who will be your, who will look after your IP for you. They'll do the relationships, the networking. They'll be your local partner, and you'll give away a good portion of your business to them. But they will be your entree into that market. But I think people don't understand in the West that the Chinese innovation and the Chinese businesses are sitting in China thinking exactly the same thing about the West. And if there's one thing that's true, it's the West is even bigger and more complicated for a Chinese organization to penetrate than China is to an Australian company. So, and I actually think that the advice you need to give a Chinese company looking to innovate offshore is exactly the same. Find yourself local partners, find yourself, be prepared to give up some of your business for that local nuanced knowledge. Go and start with a trial somewhere on a small scale. Make sure it works. Make sure you understand the user concerns, and if it is data, then you can solve that. And that was really what I was sort of part of the thesis of the presentation earlier, was about using Australia as an example of a place where you can do that market study, do that product innovation and localization work. Just the same as if we had a product here or a digital tech here, you know, the Chinese government wants to make sure that, you know, it's safe and cybersecurity is respected, and you'd go and start with a pilot, you'd find your local partner and you'd pursue it that way. So I think it's sort of interesting to think that, you know, my counterparty in my hand sanitizer business, it was essentially a failed business when I picked it up. And it partly failed because there was a fundamental mistrust between our manufacturing and joint venture partners in China and distribution partners and the Western management. And, you know, I went over to China, spent a day in Dongguan, spent with them. And what became apparent is they were just decent individuals trying to make a business just like we were. And we've had a really robust partnership since then. And I think that's a great example of just how letting geopolitical mistrust influence personal, bilateral, individual relationship mistrust can just derail what could otherwise be really great win-win partnerships.
Yes, thank you, Michael. I would argue also Melbourne has particularly advantage to attract some of these Chinese startups to commercialize their product and with a local partner. So we were looking forward to facilitate that. So I've got a question now coming through the audience. So I would like to go to Zach. Zach, can you comment on the current COVID-19 vaccine manufacturing in Australia, US, and China? I know you're not a infectious disease expert, but I'm sure you follow this closely.
Thank you, Joseph, for the question. And again, I will caveat everything I say. Please take it with a grain of salt, given that by no means am I a infectious diseases or vaccine expert. But I will say a few things. I think, you know, the vaccine, the COVID vaccine, in my mind, and I say this from the lens of a healthcare practitioner, it should be a public good. You know, there's a clear pressing need for it in all countries around the world. And unfortunately, it has become we are viewing these vaccines increasingly through a geopolitical lens, whereas fundamentally they are a public good which address the needs of peoples all around the world in all different countries. And there are a number of initiatives, multilateral initiatives which support that now. It is a race. I think we're starting to see very promising results recently shared by Pfizer as well as Moderna, and there were some recent encouraging results as well from the Oxford adenovirus technology, which is quite similar in sort of technology to some of the leading Chinese candidates. I think this is not a winner takes all type of race. I think this is something we're going to be dealing for a long time. These different technologies have their comparative strengths and weaknesses. I think one of the main challenges that we're going to see now is actually distribution and supply chain. The mRNA vaccines in particular, just by nature of that technology, is very fragile and has to be stored in a very secure cold chain environment. And I think there'd be a role for all these different vaccine technologies having a place to play in different countries and different settings. I think the indigenous, the domestic Australian vaccine, the UQ protein subunit vaccine, I think again has highlighted the strength of our medical manufacturing and research sector. We might not be the first to market. I think the latest press release I saw was potentially somewhere between sort of July to September next year as wrapping up phase 3 trials. But the fact that we are able to create a vaccine with Australian technology, as well as have domestic manufacturing onshore with CSL, is pretty remarkable, and we shouldn't forget that.
Great, thank you, Zach. Perhaps one last question, Carol, goes to you. So, audience, would like you to comment on the function role retirement village play in a stepping stone to lower and then high aged care facilities.
I think that we're going to see that the retirement living area has huge potential for moving into this more consumer-based care. Retirement villages or homes can provide services if and when people need them. The basis now is to provide services in the home. So I think you're going to see more integrated retirement home care and small aged care. Aged care, I think in the next 15 years, is going to move much more to respite care, which is on when people need it, but then can go home. And then for palliative care, where people in the last 6 to 8 months of their life are reaching the end of their life and they need more intensive care. So I think you'll see a move away from more people going into residential care and moving into retirement living where they can maintain much more independence.
Great, thanks, Carol. So I know we love to chat all day, but some of us have other commitments, and I'm also holding up people for lunch. So I'm gonna just providing a closing comment, if I may. So I think we all agree it has been a wonderful session today, and including the session in the morning, which I'd love to attend. I didn't have the opportunity. And then I think also the second thing we all agree is that Australia and China can be great partners, or even some would say natural partners in collaboration in health. There are so many complementary elements between the two countries. What this pandemic has shown us is that healthcare collaboration is imperative on a global level, particularly countries within our region. While I have no doubt there will be continued engagements between Australia and China, despite the current political environment, but the collaboration would really flourish if the political environment improves. So on behalf of the organizers, I'd like to thank all our speakers and panelists for your time. And last but not least, we'd like to thank the audience for your interest and attendance today. Thank you thank you, and I wish you have a wonderful event. Now, we will have a short lunch break, and please come back to the session at 1:40. Thank you very much.
Thank you.
这是中澳政商学界携手打造的商业盛会，这是两国最有影响力的商贸交流平台。澳中博览会20+21如约而至，将分别于2020年11月20日于线上，2021年7月22日于线下墨尔本会展中心举行。 博览会组委会主席由澳大利亚前贸易投资部长安德鲁·罗布阁下担任。罗布先生在任职部长期间，推动和主导了澳中自由贸易协定，在澳中经贸关系中发挥着极为重要的积极作用。博览会官方合作伙伴是澳大利亚中国工商业委员会和澳大利亚中国总商会 （ECBC）， 是澳大利亚政府的商业顾问。CCCA 是澳洲中资企业的代表性联合组织，他们是澳中经贸合作领域中最权威的组织机构。博览会获澳大利亚联邦政府贸易委员会和维多利亚州政府的官方支持，作为澳中两国间最具代表性和影响力的年度经贸交流盛会，为澳中企业增进了解互信，创造了合作商机。2019澳中博览会的主论坛和各主题论坛邀请了数以百计的各界大咖现场演讲和交流，获得数百家澳中企业和组织的积极参与，吸引了数万观众。澳中两国各大主流媒体争相报道。澳大利亚维多利亚州州长丹尼·安德鲁斯称赞澳中博览会是扩大澳中之间贸易和经济联系的极佳机会。中国驻墨尔本总领事龙舟先生也祝贺澳中博览会为中澳经贸投资交流搭建了一个极佳的平台。2020年的新冠疫情和复杂的国际关系给人类带来了极大的挑战，推动后疫情时期的经济复苏是澳中工商界的历史使命。澳中博览会将重点着眼于衣食住行学用玩等与百姓日常生活息息相关的行业，以20+21线上加线下的全新形式，在新环境中迎接新挑战。澳中博览会20将以网络论坛和线上展会的方式举行。这个大型高端商务论坛由主论坛和数个专业论坛组成，包括健康与养老、投资与地产、红酒与农产、大湾区经贸等多个专业领域。罗布阁下开幕致辞，探讨中澳经济发展的新常态、新思路、新机遇。澳中博览会线上展会强力推广，全年开放，永不闭幕。每个线上展位都是掘金之地，用来展示企业故事、产品资讯、图片和视频、联系方式等详细信息，随时入驻，随时展出，随时收获浏览和反馈。无论消费者和采购商都可以不受时间和地域限制，从电脑或手机终端进入线上展厅，或一类检索，或按名搜寻，可快速找到自己需要的商家和产品。澳中博览会21将于2021年7月23日开幕。澳中博览会21以展会、论坛、交流3大板块构建出强大的高端综合平台。为期3天的展会将吸引海量参观者，包括买家、投资人和大众消费者，是商家进行商业推广和品牌展示的最佳契机。全天论坛将邀请澳中两国政要、经济学家、行业大咖和商业领袖进行政策分析、信息分享，共同探讨商机和未来。博览会期间还将举办庆祝晚宴、颁奖典礼、专业讲座、双语人才招聘会、高尔夫友谊赛等活动。澳中博览会汇集两国官方及工商界信息和资源，成千上万的参与者通过这个多层次的互动平台，拓展人脉，寻找机遇，合作发展，互惠共赢，推动疫后经济复苏，造福两国人民。联通澳中，创造价值。澳中博览会20+21邀您共襄盛举，让我们2020相会在云端，2021相会在美丽的墨尔本。
在距离墨尔本市区2个半小时车程的地方，有一座世外桃源。卡梅尔山脉提供了天然屏障， 隔绝了风暴与沙尘。几十年来，这里湖泊宁静，候鸟群飞，阳光充足，土地优渥。寒武纪时代遗留下来的古老土壤，形成了质地均匀的红色粘土地，让这里生产的葡萄颗粒饱满，甘甜可口。其中最出名的就是西拉子和赤霞珠。葡萄园旁边就是酿酒厂，酿造葡萄酒时，整个庄园果香四溢，沁人心脾。这里就是湖泊酒庄。经过庄主的悉心管理和酿酒师的精心酿造，这里生产了大批馥郁醇厚的葡萄酒佳酿。这其中，布鲁塞尔葡萄酒及烈酒大奖赛向来被誉为酒中奥斯卡。湖泊酒庄引以为傲的品牌狂想曲，在2020年一举夺得该大奖赛的金奖。在湖泊酒庄的酿酒环节中，始终如一地坚持着小而精的精英路线，摒弃对葡萄酒的人工修饰和添加，最大限度保留葡萄中的天然和风味。这样酿造出来的葡萄酒，无论新酒还是陈酿，都能为饮者带来味蕾的盛宴。湖泊酒庄的夙愿即将落脚在这片枝繁叶茂、硕果累累、缱绻富裕的葡萄园，而这美好的愿景源自于一代又一代的传承与创新，就像葡萄酒的酿造一样，在日月更替中积淀、发酵，再焕发新生。而湖泊酒庄的葡萄酒事业也将在薪火相传中生生不息。
具有国际前沿技术和资源高度整合的澳大利亚贝恩医疗集团，集各种核心优势于一身，以具有国际领先的医疗养老、干细胞抗衰老、癌症医药研发、全球转诊、疫苗普惠、医院托管、医院国际化认证、科技项目孵化的前瞻优势为核心竞争力，以中国市场为海外拓展方向，力争在中国市场上建设一批国际一流水准的综合医疗产业。IOL Medical Group Pte Limited 澳大利亚贝恩医疗集团有限公司。
Welcome to ViPlus. The ViPlus was established in Tura, Victoria in 1893. Formerly known as the Tura Dairy Factory, it's one of the oldest and most trusted dairy producers in Australia. We've been supporting the nutrition of you and your family for more than 120 years. In 2013, ViPlus launched our very own milk formula brand, ViPlus Nutritional Milk. ViPlus starts at the source in South Gippsland, Victoria, one of Australia's most renowned golden pastures. We believe fresh, high-quality milk is the essential first ingredient for producing the best powdered milk formula products. We farm only purebred, grass-fed cows and encourage plenty of outdoor grazing to ensure they receive plenty of fresh air and exercise. We add only the highest quality supplements to suit the specific requirements of everybody at every stage of life. Each stage of the production process is guided by gentle care and a commitment to preserving the natural goodness of pure, fresh milk. We're constantly striving to improve our processes so you can be confident that we're providing the best possible nutritional support for you and your family. ViPlus Nutritional Milk. More than just milk.